My presentation today is congenital trigger thumb. I am presenting a 3-month-old baby having bilateral friction deformity presented at the age of 3 months. This deformity was noticed at the age of 1 month, which was initially flexible and having pop sound while extending the thumb. It became fixed in 2 months' time and bilaterally. On left side, it was little flexible. Clinical examination relieves acute flexion at the PIP joint. While extending the thumb, they produce hyperextension, and there was a nodule feeling at the base of thumb on the flexor surface on both sides, right and left. This was painful on extension, but it was a little bit flexible and extension was possible with pop sound on the left side. This is the video demonstration which shows the acute flexion at the PIP joint of the thumb. And when we extend, it produces hyperextension at the base of the thumb. And nodule, which was painful, felt at the flexor surface along the flexor pollicis longus. We call it Nota's nodule. Deformity was type 4 on the right side, while Green's type 3 on the left side. To understand patho-anatomy in children, it is a rare developmental anomaly with incidence of 3.3% per 1,000 live births seen at the age of 1 month. Notably, bilateral 25 to 30%. There is a thickening of the tendon sheath and the tendon that restrict movement through the A1 pulley. This tendon swelling and thickness is proximal to A1 pulley, and because of disparity of this pulley size and thickness, there is a restriction movement with the flexor pollicis longus. To understand applied anatomy is very necessary for surgical steps. Here you can see the thumb with pulley 1 at the metacarpophalangeal joint and pulley 2 at interphalangeal first and pulley 3 here. And there is an oblique pulley as well, just distal to the A1 pulley. And over the A1 pulley on the medial side, there is a recurrent radial nerve. To release this pulley, you have to transfer vertically like this, the pulley, and release will allow the free movement of the tendon through this pulley. Be careful not to cut A3, A2, and A4 pulley. Otherwise, it will produce a bowstring effect. Treatment in children, initially, when it is flexible, at the birth till 2 months' time, there is a splintage, observation, and passive flexion and massage. But if this fails in 2 months' time, usually surgery is needed. While primary surgical decompression is recommended in children who begins this symptom after the age of 2 months, due to low success rate of conservative management, and in fixed trigger thumb deformity, which is mostly type 3 greens and type 4 greens. There are 7 surgical steps to release this pulley. We give a transverse incision on the proximal crease at MCP joint, dissect the flaps with the sharp scissors, identify recurrent radial nerve and oblique pulley, then release the pulley vertically. Be careful by saving the oblique pulley and recurrent radial nerve. Once pulley is released, check the tendon free movement with a hemostat, fine hemostat placed under and pull and move the thumb. I will give the video demonstration of the surgical steps. Here we give a sharp incision 0.5 to 1 centimeter at the base of the thumb on the palmar aspects, and with the subcutaneous dissection and with the sharp dissection with the scissors, we release the subcutaneous tissue. And while releasing the subcutaneous tissue, be careful for the recurrent radial nerve. It has to be saved. But you can see here, this is the recurrent radial nerve in the place. With easy, fine, and sharp dissection, you can save this recurrent radial nerve, must be identified. step. Then after sharp dissections, you need to identify oblique pulley and A1 pulley, and this is how to cut the vertically the pulley number 1 while saving the recurrent radial nerve here and oblique pulley here. We do not usually touch these two things and save these things. And ultimately, you must re-identify the recurrent radial nerve. It is intact, as you see here, and also seen here, recurrent radial nerve. Be careful to save this. Once you've done the release of the pulley, keep a hemostat under the flexor pollicis tendon and move the thumb as seen here, that it is moving freely without any problem. This is the stitching with the 2-0 rapid sutures, which are absorbable. Dressing with the elastocrep, no splintage, no movement for the first few 2-3 days. Analgesics are given. And after 2 weeks, you will find there is good, healthy release and good extension of the thumb without any pop sound, no pain, no clunk felt here. And we continue the exercises passively for next few months. Thank you very much for your patience. These are my contact numbers. You can find this video on the YouTube as well and on the